Hi, my name is Emily Zhao, and today I will be talking about global oral health. I am a rising senior at Chattahoochee High School in Johns Creek, Georgia. In school, I am the vice president of our HOSA chapter. Recently, I competed at the International Leadership Conference held in Dallas in the dental terminology event and was awarded first place. This year, I will continue to serve as our chapter's vice president and hope to continue competing in such events. Outside of school, I dedicate much of my time to dance, competing at ballet competitions and learning modern and Chinese folk works as well. In addition to dance, I also play the violin. I'm a part of my school's chamber orchestra and have also been accepted into the All-State Orchestra for 3 years. I also really enjoy volunteering, especially teaching younger children. This past week, I was able to go to a daycare for a few hours each day to teach public speaking and science experiments. I was also able to do a dental presentation to raise awareness for the kids at the daycare and for another organization specifically for autistic children. In addition, I intern at a dental office currently and have done research in the past regarding dental health. By attending this program, I know I will spark my interest in the medical field even more. Specifically, in the future, I aspire to pursue a career in dentistry. Some of the key topics I will be discussing today is an introduction to oral health, key challenges, potential solutions, and a conclusion. First is the introduction. Oral health, defined by the World Health Organization, is the ability to engage in actions involving the mouth, teeth, or surrounding features with confidence and with ease. Oral diseases are the most widespread non-communicable diseases affecting those in early life to old age. There are 5 main oral diseases. First, dental caries. This happens when plaque forms on the tooth surface and converts free sugars into acid. This acid may lead to tooth decay. Sometimes this may also lead to tooth loss. Second is periodontal disease. It is also known as gum disease, which affects the tissues surrounding and supporting the tooth. This is usually due to poor hygiene and tobacco usage. Severe cases can affect up to 19% of the global adult population, amounting to more than 1 billion cases. Third is edentalism. This is when all teeth are lost. Generally, losing teeth is the endpoint of a lifetime of oral disease, but can also be attributed to trauma or other causes. Tooth loss may be psychologically traumatic and may limit function. And while edentalism affects around 7% of the global population 20 and older, for people above 60 years old, the percentage spikes up to 23%. Next is oral cancer. Oral cancer is ranked as the 13th most common cancer in the world, which includes cancers of the lip, mouth, and oropharynx. Usually, oral cancer is more common and deadly in men and in older people, but it varies depending on the socioeconomic standings. Among many factors, tobacco, alcohol, and areca nut usage are the leading causes. In many countries, HPV infections are also responsible for the growing percentage of young people affected by oral cancer. Lastly is cleft lip and cleft palate. These are the most common craniofacial birth defects. In low-income settings during the neonatal period, there's a high chance of mortality. However, it is possible to be completely rehabilitated through surgery. About 3.5 billion people worldwide were affected by oral diseases in 2019 and in 2022, making them the most widespread conditions among the more than 300 diseases and conditions that can affect humanity. Oral diseases have remained the most dominant conditions globally since 1990. Among the major oral diseases, untreated caries of permanent teeth is the most prevalent with around 2 billion cases. Severe periodontal disease follows with around 1 billion cases. Then untreated caries of deciduous teeth with about 510 million cases, and edentalism with 350 million cases. The combined estimated number of cases of oral diseases globally is about 1 billion cases higher than that of all 5 main NCDs, which includes mental disorders and cardiovascular disease. Not only does oral health support individuals participating in society to achieve their potential, it is also integral to general health. Oral diseases may be indicative of other diseases, including endocarditis, cardiovascular diseases, including strokes and clogged arteries, and respiratory illnesses like pneumonia. Next, I will talk about the key challenges. A few global challenges include access and availability, affordability, isolated dentistry, and lack of workforce. Oral health services are largely demand-led, often poorly planned by public institutions. This leads to oral health services that are not always adequately aligned with the oral health needs of populations. Because independent private practitioners deliver a significant proportion of oral health care outside of the public health system, public health policymakers and politicians often consider dentistry to be a marginal issue of low priority. Where oral health services are more integrated into the public health system, it is far easier to work across professional boundaries to deliver more holistic care, as well as for patients to access and afford primary oral care. High-income countries have a dentist population ratio of 6.85 to 10,000, while low-income countries report a ratio of only 0.57 to 10,000. So you may be wondering, what are some potential solutions? So we can increase oral health information and high-quality oral health research. We can also bring light to issues of public health relevance in oral health care. We may also implement digital technologies for oral health, as well as providing fluoride for oral health, and create new categories of dental practitioners like dental therapists. Apart from gathering individual level data, performance indicators for oral health services, such as availability, accessibility, quality of services, and out-of-pocket expenditures, should be collected at a regional and national level. Lastly is the conclusion. Here are some key takeaways. Around half the population of the world is affected by oral disease. Poor oral health usually translates to other diseases. This is important because the neglect of oral diseases is reflected in significant data gaps. Fewer than a third of all countries have oral health surveillance data on their populations. So here's some solutions. We can implement research programs for better awareness and planning, as well as implementing teledentistry for increasing access and shared information. We may also increase the workforce by adding new jobs like dental therapists and provide fluoride for personal oral health. Throughout this presentation, I used these resources, and I would like to thank the GHLC team for providing this amazing opportunity, as well as the GHLC speakers for the amazing presentations thus far. I would also like to thank the audience for listening. If you have any questions or comments, feel free to reach out by email or connect with me on LinkedIn.